So good morning, Deb, and thank you for allowing me to call you by your first name, and thank you for entrusting us at GBMC with your care.
Well, thank you, John. I've certainly spent enough of this year here.
So tell me a little bit about your care. How is it going?
It's been a rough haul, but that's not primarily your fault. I mean, I have some complications. Excuse me, between rheumatoid arthritis and 5 different kinds of pneumonia in the course of a year.
Wow.
And they've had trouble, you know, as soon as we get one piece under control, another little rabbit sticks its head up out of the hole.
Okay.
So it's been a rough year. But I think I'm hoping we're over the hump.
Great. How are we doing at helping you to manage the care? I appreciate you saying that it's some of the things are beyond the ability of us to control them, but how are we doing at actually supporting you?
I think you put a good team of doctors together, and they're all working very closely together.
Okay.
Communicating about what they're doing. They're talking about what drugs we can or can't take.
That's good. So it sounds like you feel pretty good about how the doctors are communicating?
I do.
Great.
I think they really bent over backwards.
Okay, so you use this thing called My Chart?
I do.
Okay, and I'm sorry, because from my own curiosity, I want to know, is that actually helpful to our patients? Do our patients believe, because we, providers of care, we believe that it's helpful to have everything in one place. And the neat thing is the Hopkins doctors and the GBMC employed doctors all use My Chart.
Yes, they do.
Give me some ideas of things that you think we could do better.
I think your nurses are superb.
That's for sure.
Yeah, they absolutely are. I haven't met one that doesn't bend over backwards to do what they're supposed to do.
Have people been in to visit you during your stay and ask you how you're doing and how you're feeling? And
I just have found here that people are more giving and more caring. I have more doctors stop and talk to me that don't know me here. You know, just see how I'm doing. The head of this department has stopped the last 2 days to make sure I'm getting an outpatient room after all this time. So yeah, it seems to be just a tendency towards more giving.
so how often is someone coming in your room to check on you?
I say the nurses come by 2 to 3 times. Somebody comes to take your blood sugar and your blood pressure 2 or 3 times a day. Someone comes by and reminds you to eat lunch or order lunch. And aside from that, not much happens. And the doctor, however many doctors you're seeing, will stop by.
We at GBMC believe that there needs to be a clear captain of the ship for each.
Right.
No one doctor can know everything, so it's a team. But there has to be a captain, otherwise the patient could get confused with so much guidance from different people. Have you had that conversation with your primary care physician? In other words, where do you think we're going with my plan? And
yeah, actually, the pulmonary doctor, my family doctor, and the infectious disease doctor and I are all having a meeting as soon as I get out of here. Talk about where do we go.
Isn't that fabulous? A meeting of all the people together?
The 3 of us, yeah.
Wow.
And the two are GBMC and one's Hopkins.
That's fabulous.
Yeah.
That's fabulous.
So some of the barriers are breaking down.
Excellent. Excellent. Is there any other support that you need?
Yeah, you all have been pretty good. You send in, nursing group comes in, so I get PT and OT, and then someone will work with, and then a nurse comes in once a week and takes my blood pressure and goes through all the pamphlets for the different stuff you have and says, you know, this is important that you do this.
Okay,
so I
good.
get that.
Okay, good. All right, well, thank you so much for spending time with me.
Well, thank you.
It was a pleasure to meet with you and spend a little time with you. And again, let me end where I started. Thank you for entrusting us with your care. And please don't hesitate to contact me if you come up with other ideas for us to get better.
Okay.
And I hope you have a wonderful holiday season. I know you want to get out of here, and we'd love to get you out of here. And have a happy New Year.